Hello, this is Ofelia Madrigal, and today I'm going to be talking about multisystematic therapy. To do that, first I'm going to start sharing my screen here. So as you can see, multisystematic therapy, it is mainly used to work with adolescents who have experienced some alcoholism and substance abuse, especially for adolescents. So to start, we're gonna share a vignette, and this is a name, Juan, is 19 years old. This is not a real person. It is someone that we changed the name in order to protect the client. So Juan is a 19 years old Hispanic boy. He reports about his addiction to alcohol and marijuana. Client reports he lives with his parents in a small rural town in the county of Tulare, California. Client report he's the youngest of 6 siblings, being him the only male in the family. Client report he's currently in the home recovering from a car accident he had 3 months ago that almost took his life due to driving under the influence and being chased by the cops. Client report about the use of marijuana since he was 11 years old. Client report marijuana was introduced to him by one of his cousins while they were in a family party. Client report the continuation of substance use due to peer pressure and as a way to cope with undesirable thoughts and feelings. Client report it was until he was 16 years old when things started getting out of control. Client report marijuana was no longer enough to cope with undesirable feelings. Feelings such as anger, frustration, jealousy, sadness, loneliness, and rejection. Client report the use of cocaine for a short period of time, but it was never his thing. Client report heavily drinking beer and alcohol with friends until he passes out. Client report at least 3 DUIs and 4 car crashes, in which the last one, he almost loses his life. Client report in the last crash, he was in coma for 3 months, broke 3 ribs, and now he depends on a gastric tube. Client report feeling depressed mood, loss of appetite, sleepiness, lack of energy, suicidal thoughts, and feeling of hopelessness. In addition, client report excessive worry that is difficult to control, shortness of breath, muscle tension, and feeling constantly on the edge. Client report that although he doesn't have a good relationship with his parents, they have been very supportive to him through his recovery process. In this presentation, as I mentioned, I'm going to be talking about multisystematic therapy and how one can benefit from this type of therapy. To start, we're going to share about what exactly DSM-5 has to say about what is alcoholism. So as it says it here, there is really not an official diagnosis of alcoholism. The condition that has long been treated term as alcoholism is technically called severe alcohol use disorder. So there is no such diagnosis as alcoholism. The diagnosis is severe alcohol use disorder. And this is according to the May 13 publication of the 5th edition of the Diagnosis and Statistical Manual. Now, alcoholism has also different classification as a mild, moderate, and severe. And we're gonna determine at the end of this presentation what type of alcoholism is Juan presenting. So here I listed what are the symptoms in the DSM-5 that describe as part of alcoholism. So in order for us to diagnose Juan, whether he has alcoholism or not, he needs to present at least 3 symptoms of the ones that we have listed here. So the first one I have listed is alcohol is often taken in a large amount of or over long periods than was intended. We can see that Juan actually meet the criteria. There is a persistent desire or unsuccessful effort to cut down or control alcohol use. Juan has mentioned that over the past 3 years, he have intent to stop drinking alcohol without being successful. So he also made that criteria. A great deal of time is spent in activities necessary to obtain alcohol, use alcohol, or recover from its effect. Craving or strong desire or urge to use alcohol. Recurrent alcohol use resulting in a failure of fulfilling major obligation at work, school, or home. Continued alcohol use despite having persistent or recurrent social interpersonal problem caused or exacerbated by the effect of alcohol. Important social, occupational, and recreational activities are given up and reduced because of alcohol use. Currently, Juan is not working. He's at home, recovering from the injuries that he had on the last trauma he suffered due to being chased by the cops and crashing in a tree. Since Juan is presenting some symptoms of anxiety and depression, and it is mainly due to his physical health and inability to get a job. So he pretty much depends from his parents. Recurrent alcohol use in situations in which it is physical hazardous. Alcohol is in continue despite acknowledged having persistent and recurrent physical or psychological problem that is likely to have been caused or exacerbated by alcohol. Tolerance as defined by either of the following: a need for remarkably increased amount of alcohol to achieve an intoxication and desired effect. B, remarkably diminishing effect that continue the use of same amount of alcohol. Withdrawal as manifested by either of the following: the characteristic of withdrawal syndrome for alcohol closely related substance such as benzodiazepine is taken and really avoid withdrawal. So we can see there are a lot of people who is either relapsing or in the recovery process, they get prescribed benzodiazepine. So what is substance abuse and addiction? So in order for me to be able to diagnose Juan and help him with the treatment that we have selected, we have to identify whether he has a problem of substance abuse or does he has an addiction. So first of all, substance abuse is not the same as addiction. Many people confuse that addiction and substance abuse is the same thing, but in reality it's not. So here we have using substance abuse is a manner other is a manner other that is intense use are signs of substance abuse. Let me repeat this because it didn't make sense to me when I was making the PowerPoint, but now it doesn't. It's the use of substance abuse in a manner other than is intense use. Well, intent. So what we're saying here is that we are using that something in a way that it shouldn't be. So in a manner that is not. So if I'm using alcohol, but I'm abusing and I'm using it in the incorrect way in a frequency, then it is a substance abuse. Addiction is a brain disease that needs long-term management, according to Perkinson in the book. So brain is a disease that definitely is a long-term management. Addiction is a chronic disease that is incredibly difficult to control. Abuse of certain substances, such as alcohol or prescription drugs, can cause chemical changes in the brain that lead to addiction. These changes cause someone to keep using the substance abuse that they are addicted to, no matter what negative effect might be. So first, we start abusing of a substance of that something that at the beginning we might think we won't get addicted, but if we don't pay attention, the more we use it, the more we want. We're gonna start the craving until the moment that we lose control, and then it becomes addiction. So substance abuse, we wanna say that it can be the first step to the addiction. And here we have the diagnosis. How do we diagnose someone? In order for us to be able to diagnose someone, we also need to use the diagnostic and statistics manuals of mental disorders called DSM-5. and it is created by the American Psychiatry Association. This is kind of like the Bible for all the people who work in mental health. So according to the DSM-5 and based on the client's description of his current situation, one diagnosis is as follows. I have him as adjustment disorder with anxiety. And I'll tell you why. He's at home. He's struggling, with the craving of alcohol and the use of marijuana because he's under medication. He cannot take alcohol and marijuana, but he has mentioned that sometimes he does it because he doesn't know how to cope with the feelings of anxiety. So he's in the process of adjusting. He's also experiencing symptoms of depression. He's isolated. He doesn't sleep well. He doesn't eat. He lost his appetite. He has lack of energy and motivation. So he does definitely experience some symptoms of anxiety and depression. And the axis 1, we have 303.90, which is the alcohol dependence. And I also add the 304.30, which is the cannabis dependence, because he has the alcohol and cannabis dependence. And based on that, he also have the adjustment disorder with anxiety and depression. It's not that he had general anxiety or he's only depressed. It is part of the process of the adjustment for the situation that he's currently going through. So what are the symptoms that one is presenting that makes me believe or diagnose him with that diagnosis that he was classified according to axis 1? So he constantly uses alcohol and other more altering drugs until he passes out. He gets high or passes out. Client unable to stop or cut down the use of more altering drugs. Once started, despite the negative consequences, continue use brings. Continue drugs and alcohol use despite experiencing persistent physical, legal, vocational, and social problems that are directly related to the substance abuse. Because Juan has been drinking for the past 5 years. He mentioned that he had 4 crashes. He has 3 DUIs, so he does have those legal issues. And now he has those physical because of his inability to be able to cope with alcoholism in an appropriate manner, and nor having the social support that is necessary in order to overcome chronic disease as it is alcoholism. He exhibits physical symptoms of shakiness, nausea, headaches, sweating, anxiety, insomnia, and depression when withdrawn from the substance. So that's what I put anxiety and depression as an adjustment disorder. Hypervigilance, feeling constantly on the edge, experiencing contractions, difficulties, having trouble falling or staying asleep, and exhibiting a general state of irritability. So evidence-based practices. Why is it that I choose to use multisystematic therapy to work with one? Well, first of all, multisystematic therapy is evidence-based practice. What it means that there is a research that has been done for many years who have shown that this is a practice, this is a kind of therapy that can help people with the characteristics that Juan has. So this method was originally a collection of producers practiced by Dr. Scott Endler in the 1970s. Multisystematic therapy is an intense, family-focused and community-based treatment program for juveniles with serious criminal offense who are possibly using substances and young people who is exhibiting antisocial or severe conduct disorders. Juan is presenting the criminal, right? There were serious criminal offense. He has 3 DUIs. So he's abusing alcohol, he's abusing marijuana, and he's exhibiting conduct disorder. Now, This multisystematic kind of therapy is mainly recommended for people between the ages of 11 or 13 to 17. It's for teenagers, for young people, what they call it juvenile, right? Even though Juan is 19, he's not 17, he can still be, fall into that brackets where he can still use, as therapists, we can still use multisystematic therapy. And I'll tell you why, because many times your biological age doesn't match your maturity level at a mental and emotional level, right? So he might be 19 biological, but he might be immature or late bloomers, as they call them. So I decided to use multisystematic therapy with one. Multisystematic therapy is a holistic approach, and that's why it is sustainable. And that's one of the reasons why I really choose to use multisystematic therapy. It teaches a family how to foster their success in recovery. So this is not the job of only one, but it is the whole family, the whole system, the school, the community, the church, and whoever plays a role in one's life, we incorporate it in order to work as a team to create or change the environment for one to be able to stay, to have sustainable results. So the goal of multisystematic therapy are to lower rates of criminal behavior in juvenile offenders. We don't want one to continue to drive under the influence and get another DUI and God forbid get to kill someone while in the influence. So it must include the multisystematic therapy must include integration of empirical-based treatment to acknowledge a large variety of risk factors that may be influencing the behavior, like rewards for positive changes in behavior, environment to ultimately empower the caregivers. As I was mentioning, the family plays a very important role in this kind of treatment. So we also manage a quality assurance mechanism that focus on completing objectives set in treatment. So here is like the whole picture in how multisystematic therapy works. We have the child, which we can put one. We have the siblings, we have the parents and the family members, especially those people who he lives with or who he interacts more often. So we have the extended family. Juan has mentioned that he spends time with the family, with his cousins and maybe even his neighbors. But we also need to reach out to these people and see, observe their behavior. Multisystematic therapy is very intensive in some ways I want to call it a little bit of intrusive, because multisystematic therapy, we get to see clients between 2 to 3 times per week, in which it can be therapy can take place in the client's home. It can take place in the clinic or the setting where I work. It can take place in a family reunion. It can take place in a school, in the neighborhood or the community, wherever the client evolves. Treatment targets. So this is going to be the targets of the treatment. We are going to use the treatment to reduce recidivism and treatment of illness, mood disorders, including bipolar disorders. So this kind of treatment is really is so effective that you can utilize this treatment to work with people who have bipolar disorder, psychotic disorders such as schizophrenia and PTSD. We can see that one is presenting anxiety disorder and PTSD because he had 3 accidents, and he also mentioned a series of things that happened to him during his childhood but he was unable to open up because due to the first session. So we're going to give him more time and identify if he actually has PTSD and his behavior as a result of this trauma. We're going to establish a behavior plan at home in which the family is going to be included, increase caregiver monitoring of behavior, address disputes with parents and teachers. So we need to identify what are those, why is it that one doesn't get along well with mom and dad? Reduce the client's interaction with deviant peers, help the client establish pro-social behaviors in peer groups. Another part of the treatment is to individualize depending on the social systemic surrounding the youth. So every treatment is individualized accordingly to the needs of the client. That's why it is important to do assessments also in the family home. What are the goals of this kind of therapy? And what are the goals so we can help one pretty much take control of his life? So we accept the fact throughout the treatment, he needs to accept the fact that chemical dependence and he then begin to actively participate in a recovery program. So he needs to accept that he has chemical dependence and participate in the recovery program. He can also be attending to Alcoholics Anonymous for the 12-step program. Establish a sustained recovery free from those or mood-altering substances. Another goal is to withdraw from mood-altering substances, stabilize physically and emotionally, and establish a supportive recovery plan. Reduce overall frequency, intensity, and duration of the anxiety, so daily functioning is not impaired. Resolve core complex, that is the source of anxiety, alleviate the depression mood, and return to previous level of functioning. And of course, develop healthy cognitive patterns of beliefs about the self and the world that leads to elevation and help prevent the lapses of depression symptoms. Throughout the treatment, we're also gonna use other therapy styles, including cognitive behavioral therapy. And that is going to take a big role when we are trying to help the client to develop healthy cognitive patterns. So the techniques that we're going to be using, these are techniques that are implemented with this multi-system kind of therapy. So the beginning, we have the acknowledging of the alcohol and the drugs. So he needs to acknowledge, right? He needs to acknowledge that he has a problem. If he knows that there is a problem, he'll find ways to find solutions and to make changes. But if he doesn't get that as being a problem, the problem is going to persist. So we're going to reduce the family resistance to this kind of alcohol and substance abuse and drugs. So here we have alcohol and other drugs. So the family also need to work with one in conjointly with other mental health professionals. So family can approve resistance, and that's the place where therapists, talk to the family. Target one behavior at a time and reassess rules and boundaries in the house. It is very important, and that's why this kind of therapy is fascinating, because the therapist actually goes to the house and tries to identify what are the boundaries in the family, what are the rules that Juan is breaking, what are the boundaries that Juan is crossing, which is creating a little bit of chaos in the house, and that's why Juan ends up doing whatever he wants to do. So in the middle stage, we can increase responsibility from family and friends, and as Juan as well. Reestablish appropriate parental influence and interrupting dysfunctional family behavior, which is super, super important for them to have a great communication or improve their communication. Assessing and how alcohol and other drugs use affects relationships among family members, incorporate other family-based interventions such as motivational therapy. And this is something that I was mentioning. This a part of what is this kind of therapy is that it doesn't work alone. It works along with integrating other therapies, that other therapy styles and modalities, and we can integrate throughout the process. We integrate the motivational therapy, the behavioral therapy, the parent management training, which is what we were saying. Parents needs to be incorporated, and just as a child, take responsibility. Parents or whoever lives in the house also take responsibility. We do use cognitive behavioral therapy, structural family, and a strategic family therapy. And then phases implement changes strategies, and of course generalization, which at some point I kind of feel that in this list we should have add also applied behavior analysis, because one of the characteristics of applied behavior analysis is that we use generalization, because that behavior cannot only, we don't want to see that behavior to be presented only in the home. We want that behavior to be generalized overall in all areas of one's life. And here are my reference. Here are the reference that I use in order for me to have this PowerPoint presentation. Hopefully you enjoy it. And if you have any questions, feel free to share, feel free to ask. And this kind of therapy definitely is a therapy that has been out there for the past 50 years, I want to say. And it is very effective, in which I was not familiar until I was, looking for therapy techniques to be able to help one in a more effective way. And of course, not just that, but it is that kind of therapy that is also, let me see, is evidence-based practice, evidence-based practice, multisystematic kind of therapy. Okay. Have a wonderful afternoon, and thank you for spending time with me and learning more about this kind of therapy, which is very effective kind of therapy to help adolescents who experience alcoholism and substance abuse, as well as problems with their behavior, challenging behaviors.